There's a mineral running low in your body right now, and you probably haven't felt a single symptom yet. No cramping, no fatigue you can point to, no obvious warning sign. But if you have type 2 diabetes, or you're pre-diabetic, or blood sugar has just been a little stubborn, no matter what you eat, there's a real chance this hidden shortage is working against you every single day. Doctors don't always screen for it. Standard blood panels often miss it entirely. And yet research going back decades keeps pointing to the same conclusion. Certain minerals are directly involved in how your body produces insulin, how your cells respond to it, and how efficiently glucose actually gets used instead of piling up in your bloodstream. Today, I'm going to walk you through the 3 minerals I believe every diabetic deserves to understand, not as a miracle cure, not as a replacement for your medication, but as a piece of the puzzle that, in my experience, gets left out of the conversation far too often. I'm Dr. Everett Cole. I've spent more than 30 years practicing medicine, and a large part of that career has been spent sitting across from adults over 60 who are managing diabetes, sometimes for the first time, sometimes after decades of living with it. And here's something I've noticed over and over in exam room after exam room. Patients get very focused on carbohydrates. They get focused on their A1C number. They get focused on their medication schedule. All of that matters, and I'm not here to tell you otherwise. But there's a quieter piece of this picture that almost never comes up unless the patient specifically asks about it. And by the time it does come up, sometimes years have gone by. So today, I want to slow down and explain this clearly, the way I wish more of my patients had heard it earlier. No jargon, no fear-mongering, just what I've learned and what the research actually shows. Let me tell you about a patient I'll call Marjorie. She was 68 when she first came to see me, already 5 years into a type 2 diabetes diagnosis. She was doing what she thought was everything right. She'd cut back on sugar. She was walking most mornings. She took her metformin faithfully, never missed a dose. And yet her fasting blood sugar readings kept hovering in a range that frustrated both of us. She'd tell me, almost apologetically, "Dr. Cole, I don't understand what I'm doing wrong." The thing is, she wasn't doing anything wrong, not in the way she assumed. When we finally ran a broader panel and looked closer at her mineral levels, we found her magnesium was quietly, significantly low. Nobody had ever checked it before. Not because her previous doctors were careless, but because it's simply not part of the routine diabetes workup most of the time. Once we addressed it, alongside her existing treatment, her numbers began shifting in a way that genuinely surprised her. I want to be honest with you. It wasn't an overnight transformation, and I'll never promise you one, but over a few months, something changed. And that change is exactly why I wanted to sit down and make this video. What's really happening inside the body? To understand why minerals matter so much for blood sugar, you have to understand what insulin is actually trying to do inside your body every single day. Picture insulin as a key. Your cells are like locked doors, and glucose is sitting outside those doors, needing to get in so it can be used for energy. When everything works the way it's supposed to, insulin slides into the lock, the door opens, and glucose moves inside where it belongs. That's the simple version of a healthy metabolic system. Now here's what most people never get told. That lock, the receptor on the surface of your cells, doesn't work by itself. It depends on specific minerals acting almost like the oil that keeps the mechanism turning smoothly. Without enough of certain minerals, the key can still be in your hand, insulin can still be present in your bloodstream, but the lock starts sticking. It turns slower. Sometimes it barely turns at all. Doctors call this insulin resistance, and it's one of the central problems in type 2 diabetes. As we age, this becomes even more relevant, for a few reasons. First, our ability to absorb minerals from food naturally declines somewhat with age, partly due to changes in stomach acid production and digestive efficiency. Second, many common medications prescribed to older adults, including some diuretics used for blood pressure, and yes, some diabetes medications themselves, can actually increase mineral loss through urine. Third, many of us simply eat less overall as we age, and less variety, which means fewer opportunities to take in these minerals through diet in the first place. So you end up with this quiet, compounding situation. Your body needs these minerals more than ever to help insulin do its job, at the exact stage of life when you're least likely to be getting enough of them. That's not a coincidence you'll hear about in a routine 7-minute doctor visit, but it's one I've watched play out again and again in my own patients. Number 3. Zinc. Let's start with zinc, because I think it's the most underestimated of the three. Why it matters. Zinc plays a direct role in how your pancreas produces, stores, and releases insulin. It's literally involved in the structure of the insulin molecule itself. Without adequate zinc, the pancreas has a harder time packaging insulin properly and releasing it at the right moments in response to your meals. The simple medical explanation: think of your pancreas as a kitchen constantly preparing meals to send out the door. Zinc is part of the packaging process, almost like the container that holds insulin together until it's needed. When zinc runs low, that packaging process becomes less reliable, and insulin doesn't get released as efficiently as your body requires. Why aging makes it worse. Zinc absorption naturally decreases with age, and it's also one of the minerals most affected by chronic high blood sugar itself, because elevated glucose increases zinc loss through the kidneys. So there's a frustrating cycle here. High blood sugar contributes to zinc loss, and zinc loss makes it harder to manage blood sugar. Research published through the National Institutes of Health has highlighted zinc's role in insulin metabolism and noted that individuals with diabetes often show altered zinc status compared to those without the condition. I had a patient, a retired school teacher named Harold, who kept mentioning that cuts and scrapes on his hands seemed to take much longer to heal than they used to. That's actually a classic, often overlooked sign connected to zinc status, since zinc plays an important role in tissue repair as well. It wasn't the reason we started checking his levels, but it turned out to be a meaningful clue. Practical advice. Food sources rich in zinc include oysters, which are the single richest source, along with beef, pumpkin seeds, chickpeas, and cashews. If you and your doctor decide supplementation makes sense for you, typical over-the-counter zinc doses range from about 15 to 30 milligrams daily, but I want to be very clear. Zinc absorption competes with other minerals, particularly copper, and taking too much zinc over long periods can actually create a copper deficiency. This is not something to guess your way through. This is a conversation to have with your physician, ideally alongside blood work. Common mistake. People hear zinc helps insulin and start taking high doses on their own, sometimes for months at a time, without ever getting levels checked. That's genuinely risky because both too little and too much zinc can cause problems. The encouraging part is that correcting a mild zinc deficiency through diet or through carefully monitored supplementation is one of the more straightforward interventions we have. It's not dramatic, but it's meaningful. Now, zinc is important, but it's not actually the mineral I see most consistently low in my diabetic patients. That next one might surprise you, because it's involved in over 300 different processes in your body. Number 2. Chromium. Why it matters. Chromium has a very specific job when it comes to blood sugar. It helps enhance the action of insulin, almost like it's amplifying the signal insulin sends to your cells. Some researchers describe it as helping insulin bind more effectively to its receptors. The simple medical explanation: go back to that lock and key idea. If insulin is the key, chromium is a bit like a locksmith standing nearby, making sure the key fits the lock more smoothly. Without enough chromium, insulin can still be present, but its effectiveness at the cellular level may be reduced. Why aging makes it worse. Chromium levels tend to decline with age, and refined, heavily processed diets, which unfortunately become more common for people living alone or cooking less as they get older, are particularly low in chromium. Foods that are naturally rich in it, like whole grains, broccoli, and certain meats, often get replaced by more convenient, processed options later in life. Remember a patient named Dolores, 71 years old, widowed for about 2 years. Before her husband passed, she cooked full meals most nights. Afterward, she told me honestly, "Doctor, most nights it's just toast or a sandwich. I don't see the point of cooking a big meal for myself." Her diet had quietly shifted toward the exact pattern that tends to be lowest in chromium, and her blood sugar control had drifted along with it. This wasn't purely about chromium, of course. Life circumstances like grief and appetite changes matter enormously too, but it was part of a bigger picture we worked through together. Broccoli is genuinely one of the best chromium sources you can eat, along with whole grain products, green beans, and certain nuts. If you're considering a chromium picolinate supplement, studies have generally used doses in the range of 200 to 1,000 micrograms daily, though I always encourage starting conversations with your physician first, especially if you're on any diabetes medication, because there is some evidence chromium can enhance insulin's effect enough to require dose adjustments in certain patients. That's not something to manage alone. Common mistake. People assume more chromium equals better blood sugar and self-prescribe high doses without medical guidance, sometimes not realizing it could interact with their existing prescriptions. For people who are genuinely deficient, addressing chromium status alongside standard treatment has, in various clinical studies, shown modest improvements in glucose metabolism. It's not a cure, but it's a legitimate piece of support worth understanding. If you're finding this information helpful, consider subscribing to the channel. It helps us continue creating evidence-based videos like this, and honestly, it lets me know these conversations are reaching the people who need them. I'd genuinely like to know in the comments which of these 3 minerals you're planning to ask your doctor about first. Now, before I get to the mineral I consider the most important of all 3, I want to share one more story, because it illustrates something crucial about how these deficiencies often hide in plain sight. There was a patient of mine, a retired mechanic named Gerald, 74 years old. Gerald wasn't complaining about his blood sugar at all when he came in. He was complaining about leg cramps at night, the kind that would wake him up gripping the sheets. He assumed it was just getting old. When we looked closer, alongside his diabetes management, we found his magnesium was quite low. That leg cramp wasn't a random, unrelated annoyance. It was his body's way of waving a flag. And that flag pointed us directly toward the mineral I now consider the single most important one on this entire list. Number 1. Magnesium. Why it matters. Magnesium is involved in literally hundreds of enzymatic reactions throughout your body, but for our purposes today, the most important one is this. Magnesium is essential for insulin to properly bind to its receptor and for glucose to actually be transported into your cells. Without enough magnesium, this entire process becomes noticeably less efficient. The simple medical explanation. If zinc helps package insulin and chromium helps it fit the lock, magnesium is almost like the electricity that powers the entire door mechanism. Even with a perfect key and a perfect lock, if the power is low, the door opens slowly, or sometimes barely opens at all. That's what happens at a cellular level. When magnesium runs low, glucose has a much harder time actually entering the cell where it's needed. Why aging makes it worse. This is where it gets particularly important for those of us over 60. Magnesium absorption declines with age. Kidney function, which plays a role in regulating magnesium, also naturally changes over time. And here's the part that genuinely concerns me as a physician. Certain very commonly prescribed medications, including some diuretics for blood pressure and some proton pump inhibitors used for acid reflux, both extremely common prescriptions in older adults, can significantly increase magnesium loss. So you can have a patient managing diabetes, high blood pressure, and reflux all at once, taking 3 completely reasonable medications and unknowingly creating a magnesium shortage that works against their blood sugar control the entire time. Research published in journals including Diabetes Care has explored the relationship between magnesium status and insulin sensitivity, and lower magnesium levels have been associated with increased risk of developing type 2 diabetes in multiple population studies. This actually brings me back to Marjorie, the patient I told you about earlier. Her magnesium was significantly low, and once we corrected it carefully, alongside her existing medication, not instead of it, her fasting glucose readings gradually improved over several months. She also mentioned, almost as an afterthought, that she was sleeping better, and her occasional muscle twitching in her calves had stopped completely. Those weren't separate issues. They were connected the entire time. Magnesium-rich foods include leafy greens like spinach, along with almonds, pumpkin seeds, black beans, and avocado. If supplementation is appropriate for you, magnesium glycinate tends to be well absorbed and gentler on digestion compared to some other forms, while magnesium oxide, though common and inexpensive, is poorly absorbed and more likely to cause loose stools. Typical supplemental doses range from about 200 to 400 milligrams daily, but I need to be very direct with you here. If you have any degree of kidney disease, and this is common enough in long-standing diabetics that it's worth mentioning explicitly, magnesium supplementation needs to be supervised by your physician because impaired kidneys have a harder time clearing excess magnesium, and that can become dangerous. This is not a mineral to start supplementing on your own if you have known kidney concerns. Please have that conversation first. Common mistake. I see patients reach for a general multivitamin and assume it covers their magnesium needs. Most multivitamins contain only a small fraction of the magnesium your body actually needs daily, sometimes as little as 10%. It gives a false sense of coverage. Of the three minerals we've discussed today, magnesium has, in my clinical experience and in the broader research, shown some of the most consistent associations with improved insulin sensitivity. When a genuine deficiency is corrected, that doesn't mean it works the same way for everyone, but it means it's absolutely worth investigating, especially if you're on blood pressure medication, reflux medication, or you've noticed muscle cramping, restless legs, or trouble sleeping. When to call a doctor? Now, before we wrap up, I want to be responsible and clear with you, because this matters more than anything else in this video. Please do not start high-dose mineral supplementation on your own, especially if you take diabetes medication, blood pressure medication, or have any kidney concerns. Combining certain minerals with insulin or other glucose-lowering medications can occasionally cause blood sugar to drop lower than expected, and that needs medical supervision. If you ever experience symptoms of low blood sugar, such as sudden shakiness, confusion, cold sweating, or a rapid heartbeat that requires immediate attention, and if it's severe or you're unable to bring your levels back up safely, that's an emergency room situation, not a wait-and-see one. If you're noticing ongoing muscle cramps, unusual fatigue, irregular heartbeat sensations, or numbness and tingling in your hands or feet, those are reasonable, non-emergency symptoms to bring up with your doctor at your next visit, and a good opportunity to ask for a basic mineral panel alongside your regular diabetes blood work. And if you ever experience chest pain, sudden weakness on one side of your body, slurred speech, or severe confusion, please treat that as a true emergency and call for help immediately. These minerals support metabolic health, but they are not a substitute for recognizing serious warning signs. I want to close with one more story, because I think it captures what this whole video is really about. There was a patient of mine named Walter, 79 years old, who had lived with type 2 diabetes for nearly 18 years. By the time he came to see me, he'd been through several different medication adjustments, and he told me, quite honestly, that he'd almost stopped expecting things to improve. He described himself as just managing, not really striving for anything better. We did a thorough review together, and it turned out Walter had two things going on. His magnesium was low, largely related to a diuretic he'd been on for years for blood pressure, and his overall diet had drifted toward very simple, low-effort meals since his wife had also passed away. We didn't overhaul his life overnight. We made small, specific changes. A magnesium glycinate supplement carefully dosed and monitored given his age and kidney function. A few practical food additions like adding spinach to his eggs and switching from white rice to a small serving of beans a few times a week. Over about 4 months, Walter's fasting glucose numbers became noticeably more stable, and just as meaningfully to him, his nighttime leg cramps disappeared and his energy in the mornings improved. He told me, almost surprised by his own words, that he felt like he had a little more life in him. I want to be honest with you. This wasn't a cure, and Walter still manages his diabetes carefully every single day. But it was real, measurable, meaningful improvement, built on consistency, not on some overnight transformation. Let's bring this all together. Zinc supports the production and release of insulin from your pancreas, and it's particularly worth watching if you've noticed slow healing cuts or scrapes. Chromium helps insulin work more effectively at the cellular level, and it's especially relevant if your diet has shifted toward more processed, convenient foods over the years. And magnesium, the one I consider most important, supports the actual transport of glucose into your cells, and it's frequently depleted by common medications many of us take for blood pressure or reflux. None of these minerals are a replacement for your prescribed diabetes treatment, but together they represent a piece of the picture that, in my 30 years of practice, gets overlooked far too often. The path forward isn't dramatic. It's a conversation with your doctor, a simple blood work panel, and small, consistent dietary or supplemental changes made with proper medical guidance. Small habits, applied consistently over months, tend to outperform anything dramatic or extreme, and it is genuinely never too late to understand your body a little better and make adjustments that support it. If this video helped you understand your body a little better, I'd encourage you to subscribe so you don't miss future videos on healthy aging and managing chronic conditions like diabetes with clarity instead of confusion. Give this video a like if you found it useful, and please tell me in the comments which of these 3 minerals surprised you the most, or which one you're planning to bring up at your next doctor's appointment. Thank you for spending this time with me today. Take good care of yourself, and I'll see you in the next video.